computer, continue. Okay, so we're recording. I'll edit this out, but of course now you can't see the view button. Oh, there. And then whenever you guys want to go.
Okay, so our topic was breast cancer. Okay, so a little bit about breast cancer, the introduction. Breast cancer is a type of cancer that forms in the cells of the breast. Breast cancer is known as a disease because the cells in the breast grow out of control and cause bad mutations, which is referred to as cell metastasis, if I said that right. And then signs and symptoms to look for would be a large breast lump, changes in the size of your breast, redness or pitting of the skin, and then peeling, scaling, or flaking of the skin. And then these are the phases of breast cancer. And obviously, as you can see, breast cancer doesn't discriminate. It affects females, males, and any age range.
So here's just some of the data that we've pulled from cancer.org and breastcancer.org. So pretty reliable sites here. About 85% of breast cancer occurs in women who have no family history of breast cancer, which there's lots of myths out there that breast cancer is caused by genetics. That's not always the case. The most significant risk factors of breast cancer are sex and age. It is common within women of elderly age the most, but it can occur in anybody. About 43,250 women in the US are expected to die in 2022 from breast cancer. Death rates have been steady in women under 50 since 2007, but have continued to drop in women over 50. Overall death rate from breast cancer decreased by 1% per year from 2013 to 2018. These decreases are thought to be the result of treatment and advances of the earlier detection, so mammograms and just checking yourself. We'll talk about that a little later. Breast cancer is the second leading cause of cancer deaths in women, and the median age of diagnosis is slightly younger for Black women, so the 60 versus white women of 63, but it's common in all races. So there are currently more than 3.8 million breast cancer survivors in the United States. This includes the people that are still going treatment, as well as survivors that have cleared it. Since 2007, breast cancer death rates have been steady in younger women, but again, like it says over here, they've decreased for older. So primary prevention to prevent breast cancer and all those scary statistics, health promotion and risk reduction. So just like any disease, have a healthy diet, lots of exercise, limit alcohol consumption and don't smoke. So lifestyle and environmental factors influence breast cancer. So you want to take those into consideration.
Okay, so for the secondary prevention, that would just be like knowledge and identification of disease. So compromising diagnostic testing and screening is a really good resource to use. So like an example of that would be a mammogram, an ultrasonography, and then a breast examination, which is basically just you feeling your breast to see if you notice any lumps or anything out of the ordinary, and then contact a doctor if you do. So then women ages 45 through 54 should get yearly mammograms. Women ages 55 and older can go every 2 years to get mammograms or stick with yearly if that's what they would prefer. And then just knowing what your breasts normally feel like and talking to your doctor if you notice something different.
Okay, so for territory prevention, it's one of the most important and critical stages of treatment. This helps women who are going through treatment and breast cancer or other diseases. This includes behavioral habits, depression management, cardiac or stroke programs, and management campaigns. You should also limit your alcohol consumption. That puts you at greater risk for breast cancer. Maintain a healthy weight and diet, and just be physically active.
So then for our prevention program, like our group thought this is the best way. We just said you should be maintaining a healthy diet, have lots of exercise at all stages of life, not just young, not just when you're older. Just start practicing those lifestyle adjustments today. Get tested, like we said, the secondary prevention, do your yearly mammograms, do your tests, your self-examinations. And if you are diagnosed, make sure you're following up with a professional and actively doing whatever given treatment the doctor has given. So the chemo, the medication, whatever that is as they chose.
And discussion of the pathophilosophy is the breast cancer develops in DNA or genetic mutations that can be exposed or influenced by estrogen. And sometimes the DNA affects more procancerous genes like BRCA1 or BRCA2. It can also be in your family history of ovarian or breast cancer, which can increase your risk for breast cancer development. In normal individuals, the immune system attacks cells with the abnormal DNA or abnormal growth, and this fails in those with breast cancer disease, leading to the tumor growth and spread of breast cancer. And in conclusion, everyone knows the importance of prevention of breast cancer and other diseases that are life-threatening. And as an individual, you should try to follow the measures in order to prevent diseases like breast cancer. For this purpose, utilizing earlier breast cancer screening devices will help you find and indicate any changes in your breasts or like lumps to help you detect the disease sooner rather than later. And this allows you to take the proper measurements in order to catch the disease in the initial stages rather than too late. And more research is being developed each and every day in ways to enhance the procedure and preventions and medications to help the disease of breast cancer. And intervention is always the most positive aspect of any ongoing research methodology.
And then this is just our reference page with all of our references that we used. So if you wanted to go and look these up and then get any additional information, you're more than welcome to. But that concludes our topic about breast cancer.
Thank you.